News alert. High blood pressure, a silent condition for many adults, but now impacting more and more children. The growing problem often going undiagnosed. So how can parents spot the signs?
And joining us right now to talk more about that is Dr. Faris Al-Musli. He's a cardiologist at Arnold Palmer Hospital for Children. Great to have you here, Doc. Thanks for being with us.
Thank you.
So let's talk first about why we're seeing high blood pressure going up in children. What are some of the risk factors or things that are going on?
I think as the children lead more a sedentary lifestyle, then the possibility of them having high blood pressure is more. So when they are in front of monitors of TVs or video games and not going out and playing and being active as they should be, then they will be more risk of developing hypertension. In addition to that, there is a higher risk of obesity in those patients when they are actually leading a sedentary lifestyle. So they are exposed more to unhealthy food, they get obese, and with lack of activity, the incidence of high blood pressure in them will be higher, definitely.
What would you notice about your child if they have high blood pressure? Does it impact the way they sleep, the way they act?
Yeah, unfortunately, there is not much to see on the child who has a borderline or mildly elevated blood pressure. And this is the difficult part in identifying those children by their families. And I think this is one of the main reasons why the families should stick to their well visits and annual checks with their pediatrician and healthcare providers, because that's where they will be identified with either borderline elevated blood pressure or real hypertension.
What about how you treat it? Do you treat the kids differently than you would treat an adult with high blood pressure?
Relatively, yes. There's more chance that you get the problem under control without medication. So if you try to intervene early and change their lifestyle by increasing their activity, decreasing their times in front of a monitor, for instance TV and video games, and lead them to eat healthy food, then the chances of them avoiding medication is higher, especially when you identify it earlier, before other organs get affected by the elevated blood pressure, like the heart and the kidneys. So once they get into the advanced stages, then we tend to use the medication to try to control it at least.
Because long term, if you don't treat it, I imagine there are all kinds of, as you mentioned, all kinds of other problems that will then crop up, right?
Absolutely, yes.
Yeah. So you've got to get it under control now.
That's absolutely true. So you control it, like I said, if it is borderline elevated or mildly elevated with no effect on other organs, we try to avoid the medication by intervening early. And most of the times this is done by their primary care provider after the diagnosis gets confirmed, because it's not easy also to confirm the diagnosis. So most of the times you get a child who's a little bit anxious around the clinic or in front of a physician, and so the blood pressure will be high, but that's not a true elevation.
Right.
So you have to separate those kids that have what we call white coat hypertension, which is a clinical entity, actually,
yeah,
from the truthful and true hypertension. Right. And usually what we do, there are certain devices that we use, but it's not available to all practitioners in all communities. Unfortunately, probably it's only available to practitioners in big cities and in the referral centers, where we would use an ambulatory blood pressure monitor that would be hooked up to the child for 24 hours, and during that time we will record the blood pressure every 20 to 30 minutes around the clock, including the time when the child will go to sleep, and so we can see the trend,
right,
and then we know whether this is a true hypertension versus a white coat hypertension or anxiety from the environment, and then we will treat those kids accordingly, basically.
Well, it's good for all parents to know this is a possibility, and go get those well care visits, because that is the key to finding it.
Absolutely.
Thank you so much, Doc, for being with us this morning from Arnold Palmer.